Hi, this is Philip, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about pressure ulcer. We would like to empower and educate our patients concerning a very important healthcare issue, the prevention of pressure ulcers, more commonly known as the bed sore. Pressure ulcers used to be called bed sores or decubititus ulcer, but we will use the term pressure ulcer to describe the sores. A pressure ulcer is an injury to a skin as a result of pressure from sitting or sliding into the bed or the chair. Some factors which contribute to the pressure ulcers formations are skin contact with a bed or chair without frequent position changes, contact with urine or stool, diseases like diabetes that affect blood, flow injuries which restrict your body positionings and your nutritional status on medications. There are many factors that may put your skin at risk for pressure ulcers, and your nurse or a doctor can discuss them with you. Sometimes, despite all the prevention measures that are put into place, pressure ulcers may still develop. Nearly 1 out of 30 patients will develop a pressure ulcer while hospitalized for reasons you will learn about during this short video. The risk of developing pressure ulcer during your stay is 3 times greater than your risk of being involved in an auto accident. Pressure ulcers occur due to the failure of the blood to flow freely and from the tissues and are often related to sitting or lying. Healthy skin muscles or fat tissues begin to die when blood flow is slowed or interrupted by pressure. This pressure can be caused by our bones pushing down on a surface like a chair or a bed. Throughout your hospitalizations, a nurse will evaluate your risk of developing a pressure ulcer and periodically inspects your skin for signs of injury. We work together to try and prevent the development of pressure ulcers because once a pressure ulcer begins, it can become painful and difficult to treat and sometimes even require surgery. Increasing your awareness about the risk and important part of prevention. So what does a pressure ulcer look like? And the images shows that the stages of pressure ulcer. Pressure ulcer stage are designed based on the deepest part of the ulcer and the type of the tissue is affected. Higher stage ulcers represent deeper tissue damage and more serious injury. This image depicts the beginning of the stage of a pressure ulcer, which is known as the stage 1 ulcer. A stage 1 ulcer often represents as an intact with skin redness and usually over a bony area. Skin will stay red after the pressure is removed. The area may be painful, firmer or softer, and warmer or cooler or compared to surrounding tissues. This is an example of a stage 2 pressure ulcer. A stage 2 pressure ulcer represents an area where the top layer or a skin is missing with an open area being pink or red. Stage 2 pressure ulcers can also appear as an intact or open blisters. A stage 2 blister is like a roadway pothole. At the topmost layer is damaged or open, but deeper layers are mostly uninjured. This image is an example of a stage 3 pressure ulcer. A stage 3 pressure ulcer is deeper and more severe than stage 1 or stage 2 pressure ulcer. A stage 3 ulcer goes into fat tissues. Dead tissue may also be present with the stage 3 pressure ulcer. In this way, a stage 3 or 4 ulcer is more like a sinkhole than a pothole. Deeper layers are affected and damage is more severe. A stage 4 pressure ulcer is the most severe from this injury. Stage 4 pressure ulcers is the deepest ulcer possible and will reach muscle tissues and possibly the bone. Dead tissues may also be present with stage 4 pressure ulcers. There are also 2 additional stages of pressure ulcers. One is called unstageable because there is so much dead tissues in the ulcers that cannot see how deep it goes. The other type of pressure ulcer is called suspected deep tissue injuries. A deep tissue injury pressures also usually begins with the skin that is not broken and it is usually a purple or dark purple in color. However, this type of ulcer can very quickly open up and become a deep injury. Now that you are more familiar with what a pressure ulcer is and what it can look like, you're ready to learn how we can work together to try and keep you or your loved one from developing a pressure ulcers while hospitalized. An important part of the solution is to understand the value of frequent turning and turning correctly. This demonstration shows how pressure ulcers form. In this image, a patient is lying on the back and the patient's skin shows areas of red that represents the highest pressures, areas that are risk for developing a pressure ulcer. This image illustrates the importance of turning a patient and turning a patient correctly. This shows the turning of the patient should include moving a patient as much as possible to allow pressure to release from one area of the skin and transfer to another area of the skin. You and your families can take an active role in prevention of pressure ulcers. First, walk with your caregivers, families, or friends at least 3 times a day if able. If unable to walk, you can move a shift yourself every 2 hours. If able, friends and families can also help you keep your heels off the bed, encourage you to shift your weight frequently, and help you if you have troubles doing so. It is also important that you let someone such as a nurse or a family member know if you have a soreness or tenderness which may make it more difficult for it to move. In addition to staying off your back as much as possible, it is very important that you eat and drink whatever is recommended, as well as call for assistance if help is needed for a bathroom use or for assistance with a wet diaper or a wet sheets. Whether you are in chair or bed, most importantly, all of your healthcare providers want to answer any questions you and your families may have so that you have the best chance possible to get well in the hospitals for pressure ulcer free.